Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. Today's focus is on cardiac lecture number 51, heart blocks, third degree heart block. With a normal PR, it's a baseball thing. Alright, let's get into it. So in my previous lectures, I've been talking about this sticky note found on nursingkamp.com, Facebook, Pinterest, Etsy, or nursingkamp.com. And what we've been covering is baseball. And when we're looking at it, we're talking about the structure. And baseball has four bases, right? So we have a home plate, first base, second base, and third base. And what these are is QRSs. So those are QRS complexes. Now the journey to bases are the PR. Okay? And a normal PR is 12 to 20. So we've been talking about that. That's a normal player. Okay. Then we talked about our first player of the team is slowpoke. And slowpoke is a first degree. It's number one. He is our first baseman. And he takes a long journey to every QRS. So his PR interval is long. Okay, and that is type 1 heart block. Okay, the big thing about it is that the PR is long, but there is a QRS before every complex, after every complex. So you're always getting conduction. The next one we talked about is our second string line, which is up here, where there's two types, right? So there's the second baseman and then the shortstop. We'll talk about the second baseman first. Because the second baseman talks to the first baseman, and that second baseman kind of follows the same idea as the first baseman. And his name is type 2, second degree, type 1, Winkebach. So what he does is he follows first base's idea. He's like, oh yeah, go long. So he goes long just like first degree. But what he does, he goes longer and longer, and so long on the third one that he ends up not forgetting to touch a base. So it's a method that we call going, gone. So you see the PR is getting longer and longer, so much in fact that you miss a conduction. No QRS. So Winkebach, go back to touch third base. Okay. So that's type 1, second degree heart block. Right, the next one is shortstop. And our shortstop doesn't listen to anybody. He's got his own thought process, but he is in the second base section, so he is 2. He's type 2, and he plays the same game. But he doesn't listen to what the shortstop and the first baseman say. He's like, no, I just need to go really, really fast. And what he does is he goes from here to here. So his PR interval is normal. It's 12 to 20. 12 to 20. But he's so schizo, that's not a great word, but Mobitz, is on the fritz, that he skips a base. He doesn't contract. He doesn't, so you'll see P waves and you'll see no contraction. So he misses a contraction. But his PR interval is normal. Okay? That's second degree type 2, Mobitz 2. Alright, so the P's are marching up but missing a QRS. Alright, so then the last one we're going to talk about is type 3. Okay, or third degree. Now, third degree heart block. Alright, he's the third baseman. Now, the third baseman gets a lot of line drives to his head, and he gets a little bit disoriented. So, he, number 3, third degree, he's a little bit loopy. So we're going to call him loopy. And the reason he's loopy is because he doesn't really know where the bases are. So he kind of just goes wherever he goes. So what happens with him is the PR and the P waves, they don't make sense. So you'll see them kind of marching with QRSs just happening. So the QRSs are contracting without the P's any relationship with them. So you have the P wave, the player doesn't know the rules of the game. So he runs it by his own rules. He just goes wherever he's going to go. So you have P waves are marching out and QRS are marching out in different places. There's no organization. So he's loopy. It's very disorganized. And that's a big problem with third degree heart block, because this person needs a pacemaker. He needs something to set the rules into place, because this guy is just kind of running around, and what can happen is he could hit one of these contractions at the wrong time, and then he can go into VTAC. So, what happens is that the atria is contracting independently, and the ventricle is contracting independently with no relationship to the P waves. That is acute. And that's why third degree heart block is acute. And that patient needs a pacemaker. All right, so let's talk about some why it's such a high risk. Because they need a pacemaker, and they need monitoring. So a person on third degree heart block, they Brady down in the 20s and 30s. And that's pretty problematic. And that's acute. What are some reasons for some of these with third degree? Is that you're looking for there's a conduction problem. It could be electrolytes, it could be calcium channel blockers, myocarditis, beta blockers, amiodarone. But generally, there's a problem underlying. But more important is that this person is at high risk, and they need to be on a monitor and lead too, and might even have pacer pads on them. They might not be on, but they're ready in case that person goes into a complete heart block. So third degree heart block can go into a complete heart block, which means that that patient is flatlining, and they are not perfusing at all. They become symptomatic, and they become acute. Well, that's about it. That's my take on heart blocks and the basic understanding of what's going on and what you need to know from the sticky note on baseball and heart blocks. You can download that Instagram, Facebook, Pinterest, and Etsy, and nursingkamp.com. We'll see you next time. Nurse on.